And it's time for Dr. K, Dr. Kevin Kavanagh. He's a retired physician, also founder of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
How are you this morning, sir?
Well, pretty good. Little under the weather, but not too bad.
Well, good. I hope you're not too far under it. Dr. Stack reports 99% of individuals in the hospital are unvaccinated. What's that about?
Well, it's about you better get the vaccine, because that's right. 99% are unvaccinated. And as you know, Jack, the vaccines are very good, but they're not 100%. So these healthcare workers are really placing themselves at unnecessary risk to take care of patients who shouldn't be there in the first place if they would have gotten vaccinated. And at this point in Kentucky, every death that we're seeing is preventable. And that is something that I think is really, really heartbreaking. And it's preventable by getting a vaccine. These vaccines are highly effective for the variants that we currently have in Kentucky. And last week, and actually yesterday, I spent an enormous amount of time trying to look at vaccine effectiveness for the Delta variant. And Jack, the news is good. If you look at keeping yourself out of the hospital, it's in the 90%. And the 80% figure, that is for preventing symptoms so that you will not get symptomatic COVID. And as you know, one of the things you also want to prevent is long COVID. So the Delta variant, that also, although it's highly infectious, those that are unvaccinated are at risk, it's also very susceptible to the vaccine. So if you're vaccinated, you will get protection from that.
All right. 2 weeks ago, they said 10% of the cases in the United States were the Delta variant related. And then the end of last week, 14%. This week, they're saying 20%. So in less than 2 weeks, it's doubled. And I'm assuming that that's going to continue to happen. If it does continue to happen, it's going to be a matter of days before it's going to be extremely serious in this country, right?
Well, that's correct, and mainly in the pockets of our nation that aren't vaccinated. That's what's so frustrating about this. And unfortunately, Kentucky falls into that category. To give you an idea of the infectiousness of the Delta variant, it has an R0 of greater than 6. That means for every person that comes down with the Delta variant, they'll spread it to 6 other people. If you compare that to the flu's R0 is 1.3, which means for every 5 people that come down with the flu, they'll spread it to 6 people. So this is much more infectious than the flu. The herd immunity calculation at an R0 this high would have to be greater than 83% of people being immune to this variant. And that probably isn't going to take place. If you read some of the Indian literature or news media, if you look at what happened in Delhi, they had over 50% of their population seropositive to the wild-type virus. And of course, that doesn't count the seronegative people that have memory B cells. That would be on top of that. And they then just got decimated by another wave from this Delta variant. So it is very important that we get our immunity up as high as you possibly can by getting the vaccine, and you have to get both doses. Remember, the vaccine is also based on the wild type, and so you want 2 doses to get your immunity super high. And that's the big plus about the vaccine. It is relatively extremely safe, one of the safest vaccines that we've had.
All right, let's go to the phones. Thanks for holding, John. You're on the air.
Yes, Dr. Kavanagh, just a question. So I had my vaccine probably 2 months ago. I had my 6 months blood test done here last week, and they just checked for COVID antibodies. Have never been sick through this, and they called me the first of the week and said that I had high levels of COVID antibodies. Anything to do with the vaccine, or does it say that I've had COVID?
Well, it depends on what type of antibodies they tested for. The vaccine gives you only neutralizing antibodies. That's these mRNA vaccines. And so if the antibodies were the neutralizing antibodies, it's from the vaccine. Now, if you had both neutralizing and binding antibodies are kind of antibodies that miss the spike protein. They don't do that much good, or not as much good as the neutralizing antibodies. If you have both of those categories, then you may have had a prior infection. But even if you've had a prior infection of COVID, remember, that's to the wild type. No one goes around saying, hey, I had the flu last year, so I don't need this year's vaccine. And believe me, the same thought process needs to apply. You don't say that, you get vaccinated, and you need both doses of the vaccine to get your antibodies as high as possible.
Right. So, but through this whole thing, as far as I know, I never was sick, but probably I was a carrier or not.
Well, no, you could just have your antibodies due to the vaccine. That's what the vaccines do. They mimic the infection without giving you the severe complications. So you want to have antibodies. If you didn't have any antibodies, you'd be in trouble.
Thank you. Here's a text that says, how safe is the vaccine during pregnancy?
I think it's a lot safer than getting COVID. From what I'm hearing, most people are recommending getting the vaccine. And, there's always some complications with vaccines, and you're hearing a little bit about that, for example, from the myocarditis, which came out this week. But when compared to getting COVID, and believe me, with this Delta variant, if you're not vaccinated, your chances of getting it are extremely high. Compared with getting COVID, the vaccine, in my opinion, is going to be much safer. But again, it will depend upon comorbidities and everything else of patients. So that's a question. If you're pregnant, you need to ask your doctor to get specific advice on what you should do.
What's the latest on this latest information that there's some problem with young people and some sort of a heart disorder who've gotten the vaccine? My understanding is very, very rare, but it does exist. Can you tell us anything about that?
Well, it does, and it's really not all that surprising because remember, the vaccines try to mimic a safe type of infection, and safe is relative. But these vaccines are extremely safe. So when you look at people that have been vaccinated and whether or not they develop any sort of a heart condition, there's been a little over 1,000 cases of heart inflammation that have been reported in people that have gotten the vaccine. Now, this is out of 300 million doses. And remember, 1 million is 1,000 thousands. So you're talking about only a little over 1,000 people compared to getting COVID. If you all can remember, all last year I was talking about the young athletes that were coming down with myocarditis with COVID, even if you were asymptomatic or had mild symptoms, you were getting this myocarditis. It is extremely common. So again, if you're worried about that problem, it is much better to get the vaccine than to take your chances with the COVID virus, and especially with this Delta variant.
A couple of texts here for you, Doc. Dave, I disagree with you, but totally respect your opinion, and you're right to it. He says this will never end. Always a new variant, new vaccine promoted by overpaid propagandists. I am a non-believer. Dave is not alone in that opinion, is he?
Well, unfortunately, that's probably true, Jack, but he's wrong, and unfortunately may become dead wrong, both literally and figuratively. This Delta variant is very disturbing, and also the problems with long COVID. Just yesterday, there was a report in the Washington Post covering the study out of England that shows almost 4% of their entire population is having symptoms of long COVID, meaning fatigue, insomnia, brain fog, respiratory problems, etc. And he's right. If we keep spreading around the virus and we keep ignoring it, we're going to be hit with variant after variant after variant, which may well be problematic. As we've talked about before in the show, there is also a Delta Plus variant, which is somewhat scary because it may evade the immunity more. However, I'm very hopeful that it won't spread much. In other words, it's losing its ability to be as infectious. And the data from outbreak.info shows that. So as the variant changes that spike protein to evade immunity, It also may change it to a point where it can't attach real well to the cells. And that may be what's happening there. So that's just something we're watching. But we shouldn't just watch those things happen. We should also respond proactively, and let's take steps to avoid this catastrophe that's going to be happening in unvaccinated individuals. And that's the key there.
All right. Here's another text. Doctor, please explain any research for 12-year-old females who have not gone through puberty and the impact that the COVID vaccine might have. Is there any reason to believe the vaccine can impact reproductive systems, etc.? I have heard of a woman in menopause having some issues after the vaccine.
Well, they have researched that, and the consensus, strong consensus, is no, the vaccine will not affect reproduction. If you're over the age of 12, you do need to get vaccinated. The narrative that children, it's just not a thing to have COVID-19, that's not the case. With these new variants, they're more likely to get symptomatic. And even with the wild type virus, they can easily spread this disease. Currently in England, they've had 181 confirmed outbreaks in schools during the last 4 weeks. Germany also takes spread in schools very seriously. They're testing their kids twice a week. So that's key. You've got to do something. You just can't say you can open schools safely so we don't have to do anything. No, you can open schools safely if you take proper steps. So please get vaccinated. There is evidence and concern that a COVID infection can affect your ability to reproduce if you are a male. Just concern, but the male sex organs have very high levels of the ACE receptor, and there's concern that they may be one of the targets of the virus. So again, vaccination protects you. Not being vaccinated puts you at risk.
As it relates to the Delta variant, the reports that I've read are indicating that the Moderna and the Pfizer vaccines are effective, but they don't mention the Johnson & Johnson. Is that because they don't have the data to back anything, or what's up with that?
Well, that's correct. The main problem is that most of the data we get is out of England right now, from the Public Health of England. CDC doesn't have that much data. Well, one of the reasons is the Delta variant hasn't been on our shores that long and that many individuals infected. In England, the Johnson & Johnson vaccine is not one which is commonly used. They do use the AstraZeneca vaccine along with the mRNA vaccines, and all of those are effective. And because the AstraZeneca vaccine is highly effective, I would expect, but have no data to back it up, that the Johnson & Johnson vaccine will also provide you with at least some protection.
Less than 30 seconds. Any news on a booster as a possibility?
Right now, they are talking about a booster at some time. They're not sure when. They are still monitoring the people who have had the original vaccine way back last year to see whether or not they're developing symptoms. Certainly, if you're at high risk for COVID, you need to consider a booster when it becomes available.
Thank you so much. Hope you have a great weekend. Thank you, Dr. K.
Thank you, Jack.